Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to this special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from ViVE25 in Nashville. Very excited to be here. The prominence of this specific show grows every year, and I feel very fortunate to be able to broadcast annually from this event. Rich Scarfo and the entire ViVE, Chime, and Health team have been extremely supportive, and I'm tremendously grateful. Also, a special note of thanks to Dan Kendall and the Health Podcast Network for his support in managing the demands of my ViVE broadcast and all of the recordings. Also, Roberta Mullen, the entire team at Healthcare Now Radio. I'm certainly grateful for all of you. This is my 11th year broadcasting from a healthcare industry conference, and these teams help make every show and every broadcast better. That's how we won the Sway Health 2024 Healthcare Podcast of the Year Award. For today, though, I have a fantastic lineup of CEOs, CIOs, care providers, policy leaders, and visionaries. As many of you know, my goal for broadcasting live each year from these key conferences is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. My goal, along with all my guests here, will be to offer tactics and strategies to not only survive, but to thrive as you navigate your hospital, your practice, your company, your family, all through these changes occurring in healthcare today. There's more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practice and innovation can support our efforts. I hope you glean all of that over the next few days. That's at least my goal. Thank you very much, everybody, and stay tuned. Welcome back to This Just In Radio Show, broadcasting live from ViVE 2025 in Nashville. I'm very excited to introduce my next guest and new friend of the show, Pooja Babbrah, Executive Vice President, Strategy and Industry Alignment for the National Council for Prescription Drug Programs, or the NCPDP, as all of us know you as. Welcome to the show, Pooja.
Thank you so much.
Great to have you here. So I assume, when did you get in town?
We got in Sunday night.
You did?
And,
okay.
So be here through Wednesday, as long as the snow doesn't do too much damage.
So you got in, so I had about a 7-hour delay getting in. Got in about midnight last night. So.
Okay.
You got in okay?
We got in okay. You know, we're based in Phoenix, and a little bit chillier than we expected, but still nice, of course.
Yeah, it's high 20s right now here. Yeah. I think it is. It's going to get colder every day. So, what progress are you most excited about seeing in the industry today?
Yeah, I think the thing I'm most excited about is we're seeing an expanding role of the pharmacist. Clearly, we came out of the pandemic, with the pharmacist being able to do test to treat, immunizations, all that, but really now focusing more on including pharmacists as part of the care team. Mm-hmm. I think there's a couple of examples where pharmacists can play a role in chronic care management. CDC did this great program in University of Michigan where they put pharmacists in with primary care physicians to help patients control their hypertension, and proved just great outcomes of having the patient see the pharmacist and not just their primary care physician. We're also seeing pharmacists play a role in reducing hospital admissions. So prior to joining NCPDP, I was a consultant and worked with a lot of health systems and health plans. And we saw that hospitals, as they were discharging their patients, would bring in community pharmacists to make sure that the patients really understood how to take their medications, do the med rec to make sure whatever they were given in the hospital isn't going to interact with their medications that they were on. So I think that's really what I'm most excited about, and the work that we're starting to support at NCPDP as well.
No, that's fantastic. I came across that certainly doing some care management, the chronic care management work, and seeing how integrating the pharmacist into that process, into that care strategy, certainly is a great benefit to patients, so, in the community in general.
Absolutely, and I think also just the shortage of physicians we're seeing. I mean, the primary care shortage. Pharmacists can really help play a role in rural communities, or even helping out primary care docs as they start to have to see more patients because of the shortage. So that's the other area I think that we're really starting to see some progress in.
Love it. So in my show, we focus a lot on health strategy, best practices, and also trends. So I guess what healthcare or digital health trends are you seeing in the industry today?
Yeah, there's a couple things that we're seeing at NCPDP. I think transparency. So price transparency, which would be right. Yeah. So, again, kind of prior to joining NCPDP in my prior role, we've had on the provider side the ability for providers to check how much it'll cost a patient for their medication when they get to the pharmacy counter. I think that's important to bring to the patient as well. I mean, doctors don't have time to price shop, right? The medication. So really that transparency for patients of how much is their medication going to cost out of pocket when they get to the pharmacy. So a lot around kind of transparency. The other trend we're starting to see is around personalized medicine. Now that can take it could be PGX, it could be other, digital therapeutics. We're starting to see really a lot of kind of healthcare consumers, right, trying to say, hey, we've got all these watches, we've got devices, all of that, and we're
pharmacogenomics. PGX is pharmacogenomics.
PGX pharmacogenomics, correct? Yeah. Sorry, use a lot of acronyms in this industry. But those I think are two things, and the biggest thing is making sure that health plans are going to cover things like digital therapeutics, as well as making sure that we're being more transparent in terms of pricing of medications, things like that. Those are really the couple trends that we're starting to see.
Yeah, love that. And I mean, I've always known NCPDP just from my days. I was the chairman or co-founder and chairman of the EHR Association, and so we worked hand in hand with you guys back in the early 2000s and even in later than that. So I had a great respect for your work, but never had you guys on the show before. So your work is extremely well aligned with what we want. So,
thank you. And I think the difference, and so prior to joining on staff, I was the chair of the board, and that was just as we were coming out of the pandemic, and that's where we started to recognize as an organization that, our standards are there, right? They've been around for 50 years, Absolutely. They work, but now how do we really support that kind of going beyond? So it's more about the care coordination, innovating, improving quality measures, and we're really starting to see how pharmacists are able to do that.
Well, and again, I go back to I'm really excited with your work on chronic care management. You're getting care coordination is fantastic. When you're actually diving into solving real world problems for these patients and really bringing a higher quality life to them and, tackling chronic care, then that's a significant benefit.
Yeah, and we're even see programs where pharmacists are playing a role with in maternal health. Because if you think about it, we often see our pharmacists more than we see our primary care doctors.
Almost in every case. 99% of care.
Yeah, so they could play a role there as well.
Absolutely. So what are 2 or 3 best practices or strategies that you could share that helps others navigate those trends around,
Yeah, I think so. There's a couple things happening in the industry. Obviously, as NCPDP, we are really looking to bring more health plans into our membership, more provider groups. We're really starting to focus on, how do we use pharmacists to improve quality measures, but we need to understand from the health plans and the providers, how do they want to utilize pharmacists. So I think there's that. We also just recently started under the Sequoia Project, a pharmacy interoperability work group. So a couple years ago, HITAC had a pharmacy interoperability task force. I sat in on that. We gave ONC-ASTP 34 recommendations at the time, and they've actually reached back out to NCPDP, ONC has, to say, how do we move these recommendations forward? And one of the big ones was, how do we get the clinical data flowing from providers, health plans to pharmacists. So we started this under the Interoperability Matters work umbrella under Sequoia Project, just kicking off a pharmacy interoperability work group. We had a meeting last week, and it was great to see that. I mean, we had QHINs, we had pharmacy tech vendors, we had providers, health plans. So that's really, I think, also where I would suggest people start to get involved, because we're really looking at, we don't want to reinvent anything, right? We want to use what's existing. And I think a lot of the health plans, just because of the regulations, the health systems have had to put things in place. Let's utilize what's there. So.
Yeah, actually, strong sweet spot in my heart for Sequoia Project. I was on their board for many years. Marianne Yeager's a great friend of the show, great friend of mine in person. Dee Davis, also from Sequoia Project. Love her.
Love her. Yes, absolutely.
No, that's fantastic work. So, thinking beyond today, what are a few strategies or trends that we must be ready to navigate in 2 to 3 years from now?
So I think the biggest, to me, that the elephant in the room is reimbursement. I think that if we are going to start having pharmacists do more of this clinical services and, doing all of that, how do we make sure they're getting paid? We have found pockets, right, where health plans are starting to wrap pharmacists in. They're doing the payment, but it just breaks my heart because, things that you hear is, oh yeah, we're faxing patient lists or we're cutting them a manual check. And I'm like, okay, there has to be a better way. So I think trying to think outside the box, right? I mean, still today, pharmacists get reimbursed for dispensing medications. Right. I think having models in place, thinking about how we wrap them into the value-based care arrangements, how do health plans say, hey, we're going to pay pharmacists to do this kind of work. I think the reimbursement is what we're going to have to figure out and navigate over the next couple of years, because we just keep saying that it's easy to start moving the data back and forth, but then how do you reimburse the pharmacist to do that?
Yeah, and I know it's a very slow evolution and everything's slow to change, but I just know so many great people that are working in that direction in the industry right now.
Yeah.
And I've never heard no pushback really against it. There's so much common sense there, but it just takes so long to change these mechanisms that we had in place for so long. But
it does.
I think we all see the benefit. Specifically with NCPDP, what could someone do to learn more? Is there a work group? Is there how people engage? Go to the website, check out certain pieces. But I'd love for you to tell about how to educate the community around that work.
Yeah, absolutely. So definitely come to our website. The nice thing is you don't have to be a member to participate in task groups. So task groups is where a lot of the standards work gets done. But we have started a new work group, task group that is really focused more on these care coordination, the outcomes, the care management, things like that are outside of the standard. So I recommend people go to the website to learn more. We're trying to get out. My new role here is to really start to go out to others in industry, right, and share with them what we're doing. And part of that is, reaching out to health plans and reaching out to other SDOs. We're starting to do a lot where we're really cross-pollinating, right, with HL7 Fire. We know that, NCPDP, we have the pharmacy standards. HL7 does a lot of the clinical standards, but, it's the lines are blurred, right? And so there's a lot of times you need information from the EHR. So working together with other standards organizations, Direct Trust is another one. Come to our website and get involved in the task groups and to learn more.
So if people, want to know, we've got a minute left or so.
Yeah.
What are some of the health plans that you say, hey, they're very progressive. They get it. They're figuring it out. Let's give them some airtime.
Yeah, absolutely. So the North Carolina, there's a program in North Carolina where they have pharmacists wrapped into the care team. Their Arkansas is actually credentialing pharmacists as to basically be credentialed like a provider, so they can start bringing pharmacists into the fold. Michigan is very forward-thinking. Minnesota is very forward-thinking. I just actually heard Centerwell on the stage talking about their program and how they've integrated pharmacists along into their home health and all of that as well. So those are a couple. I will say AHIP and SureScripts and APHA also did some work in this area. So, there's some great information out there about all the different programs and health plans that are doing some of this work.
Love it. Well, Pooja, thank you very much for joining the show. You're a fantastic guest, and have a great time. Will I see you at HIMSS next month?
Yes, absolutely. We'll be there. We'll be on stage actually talking about pharmacy interoperability in the HL7 booth. So,
love it. Awesome.
Yeah.
Congratulations. See you soon.
Thank you.
Welcome back to this Just In Radio show, broadcasting live from ViVE 2025 in Nashville. I'm very excited about my next guest and very good friend of the show, Rich Scarfo, President of Health. Welcome back to the show, my good friend.
Thank you for having me again.
Always. Fantastic. I assume it's been a great few days for you?
It has been an amazing few days.
Tornadic.
There you go. Weather aside, we have had an amazing couple of days here in Nashville. We're glad to be back. It's a great city to host an event.
It is.
And it's a wonderful hub of innovation and a really great place to advance the whole healthcare dialogue.
Could not agree more. This city does a great job hosting us. We do have some bad weather moving in, but everybody's taking it somewhat in stride. But again, you guys do a great job with ViVE. Chime is a great partner there with health. And this city does a phenomenal job of hosting us, making us feel welcome, and obviously the phenomenal innovation inside the Music City Center, but also inside the city. So
That's right.
fantastic. Tell us about attendance coming into the show on Sunday and Monday. So
attendance has been great. This is our fourth year. We started in 2022, Miami. Fourth year. So this year we hit about 8,000 attendees. Awesome. From last year. We have about 600 companies joining us on the floor. The cool thing about the attendance this year is 30% of our attendees are C-suite.
Yeah.
And it's the whole point of ViVE, and that is to bring together decision makers, senior executives, and the people that are able to move things forward. We had a surge in provider systems attending this year.
Absolutely.
So there are over 700 different systems represented. We have our Provider and Payer Connect program that's grown about 25% in size. So we hosted over 5,000 meetings in 2 days between sponsors and provider systems. And it's really a cornerstone piece of the event. The whole goal here with the event is to advance dialogue and have networking you can't get elsewhere.
Absolutely.
Bring people together that don't see each other at other events, and I think we kind of hit the mark on all of it.
Yeah.
We also had about 350 speakers this year across different size stages, and I think the topics were just really spot on for where we are.
Yeah,
right now.
I'll pick that up too from a standpoint of just all my guests have brought up. And even my last guest was Halamko, who brought up, the quality of conversation here, the quality of partnership being evolved here is unparalleled. And it's just, kudos to you and the whole team. You guys do a phenomenal job. And again, and actually, Rasu, we talked about this too. It's not even the quantity. It's always about the quality.
It's what we keep saying. So, a lot of people ask, how big do you want ViVE to get?
Yeah.
It's not really what our focus is.
Yeah.
I think we've talked about this in the past, and that is, of course, we want more people, we want more companies, but we want the right people and the right companies. And as our attendance goes up, if the percentage of C-suite, the percentage of decision makers is not increasing with that, then we feel that we're failing. Right. There are a lot of events out there, and they all have a different purpose, and a lot of good events. What we look at is to make sure that we can be different, and we give all of the people that show up here an experience that they can't get elsewhere, and conversations that can actually make a difference.
Yeah. So, I guess, and this was not part of our initial discussion, but let's contrast health and ViVE, because, I go to both. They're both essential in my life. Yeah. But, tell me, so if someone could not only go to one, but what's the difference, I guess, between them?
They're very different.
Yes.
And we've spent a lot of time and energy making sure they stay different.
Yeah. Good.
The audience, the overlap's only about 25%.
Okay.
Companies, about the same. So if I were to bring ViVE into a very quick description, it is a decision maker and marketplace event for the health, IT, and digital health industry. Okay. And it is, the marketplace side is very important to us, but we also couple that with the discussions and the key leaders that we bring here, and the, again, the decision makers. I would say health is a broader event. It touches all parts of the healthcare ecosystem, whereas, ViVE is about what's here and now in the business of healthcare and how systems are transforming. Health is really about where health and healthcare are going through the best use of technology. And, the innovation thread through that event is very strong. We have about 2,000 startups attending that event, about 350 on the floor. So it just gives a whole different feel to the event. And I would say that, we get into a lot more of what affects the individual through these technologies versus the hospital system at health. A lot of behavioral mental health. We'll have, of course we'll have AI and things like that, but we'll also have oral health. We'll have skin health. We are launching, our pharma community is growing significantly there, and that's something that we don't really target here at this event. We're bringing in a lot of different things that this year for health, like our food lab at health. So it's all about, the individual's experience in the healthcare system. Here, it's a little bit different, more focused on the provider side of it. And of course, the patient's at the center of all of it.
Right.
It's just two different angles to get into the same.
Phenomenal answer. Excellent. Thank you. So what's new this year at ViVE?
Well, I think we can start with the political climate. How about that?
There you go.
It has informed a lot of the decisions. or discussion, sorry. A lot of the sessions have been sort of tweaked a bit. We've unfortunately seen a lot of companies and associations and others attending that have had to remove language and different approaches that are essential to what they do. So that's been unfortunate. I think what we try to focus on is, what does the discussion look like around this? We try to stay in the center. It's important because we're a platform for everyone. So we want to make sure that we're able to bring those discussions here, and I think we've seen a lot of that. The other things that are new in terms of the event itself, our AI pavilion is probably the biggest thing on the floor that we launched this year. That's been phenomenal. We've coupled that with our interoperability area, so both have grown. I would say that in our provider and payer connect area, we're consistently standing room only the entire event. The other thing that was new is our focus on value-based care. So that's been threaded through some of the sessions, and then we also did that on Sunday as a deep dive program, and that will be something that we get into a lot more. We were really pleased to have the Best in Class Awards move to ViVE for the first time. So we've been talking with them for a while, actually since the first year, and so the awards happened yesterday, and we're really happy about that. And you mentioned Chime earlier, so the great partner, they're our partner on the event, and there's a really important demographic that they serve, and that's the CIO.
Yes.
We've seen a surge in CIOs, and we worked very closely with them to launch our ambassador program. And that really was helping CIOs get people and leaders from their systems to ViVE. And that was one of the reasons that we think we've seen a surge in representation from hospital systems. And we do it in a way that makes it very possible for them to be here, because a lot of them are obviously going through the same thing everybody else is, budget cuts, travel restrictions, things like that. So we were pleased to see the numbers that we ended up with.
Absolutely. No, and congratulations on class. That's a coup.
Yep.
I was actually surprised because I work very closely with a bunch of leaders in the industry, but AWS is one of them, and they won Best in Class for Public Cloud. And they mentioned that the announcement were moved into February, and I'm like, that can't be. It's always in March. It's always at him. Like, I don't know, and that's why you guys got it.
It's good to shake things up every once in a while.
Absolutely, I totally agree.
We welcome everyone.
Yeah, absolutely, fantastic. And actually, I had Adam Gill was at our dinner last night.
Yeah, good guy.
Fantastic. Yeah, great organization. What are you most excited about with what you're accomplishing here?
I think we've seen a bit of a shift this year, right? So as you're building something, and again, I mentioned this is only our fourth event. So
Right.
I think in chatting with the team before we got here, and
I don't think people realize that, because they synonymize you with health, and so, but technically ViVE is its own thing, and ViVE is 4 years old.
ViVE's still our baby.
Yeah.
I think the thing that's been amazing this year is we feel like it's found its place. The conversations were solid. The partnership discussions were happening. The provider systems looking at us as a go-to event. I mentioned the level of C-suite here. That's really a hard thing to do, to build and attract. A lot of competition out there, and we're advocates for everybody having their own thing that they offer. We just want to do ours the best that we can. The thing that I would say for me that was most eye-opening and really exciting this year is the presence of community health centers. And it's something that, we've had a partnership with NAC, National Association of Community Health Centers, for a couple of years now. And it's been, it's been great, side events and a lot of interest in it. But this year we had 60 different centers represented. And I learned a lot about the community health centers, in that it's the largest healthcare provider in the country. And they touch 1 in 10 citizens in the U.S. And for us to be able to provide a platform for that, and to see them thrive here in the discussions that were happening, and especially right now with question marks around funding and what's happening throughout the country, they make it possible for kids to get vaccinated, for people to get screened, for important access points for behavioral health, and all of those things are really important, because what they're serving is people that have the least access and the least amount of resources. So I love seeing things like that, because as I opened the event with some comments on Monday, and one of the things that we always remind people, or hope they remember, is that the care in healthcare is the most important part. and I think right now people need that.
Absolutely.
Yeah.
Well said, my friend. In the closing minute, what are you coming up health events that are, we obviously have health in the fall, but what's coming up? You have Amsterdam coming up?
Yeah, so we have Health Europe in Amsterdam.
Yep.
It'll be our second event.
Put you on the spot. What are the dates? Yeah, sorry.
June 16 through 19. And then we go to Vegas, and that will be, I think, our 8th year. October 19 through 22. And then we are returning to Los Angeles for one more year in February of 26, and that'll be the 22nd through the 25th. And we're actually really excited about that because there's a lot more we're going to lean into in terms of California and the innovation and the healthcare community that's there. That I think the first time we were there, again, relatively new events. We didn't lean heavily into that. That'll be a big focus this year.
Yeah, excellent. So ViVE next year will be in LA in February.
LA in February.
Fantastic. It's a good time to be in LA.
A little bit later, so we'll get away from Valentine's Day.
Yep. Very cool. Rich Scarfo, President of Health, thank you so much for being here, my friend, as always.
Thank you, Justin.
I want to say thank you so much to all the staff here on site at ViVE 2025 here in Nashville. Certainly Dan Kendall, the whole team at Health Podcast Network, and Roberta Mullen from Healthcare Now Radio. Everybody's been so fantastic in helping me and supporting me over the last 11 years. And certainly many thanks to AMD, AWS, and all the show partners here for all of their support. And to Rich Scarfo and the entire health team, and obviously ViVE and Chime teams that allow us this opportunity to broadcast every year from their different events. Big thank you to all of them. And certainly a big thank you to all my listeners and supporters. My show broadcasts weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can find me on LinkedIn and track me on Twitter, HIT Advisor, and use the hashtag ThisJustinRadio so I can respond to your comments from the show. If you missed any of this episode or anyone want to hear all my broadcasts, they're posted at Apple iTunes, Amazon Music, YouTube, Spotify, Pandora, iHeartRadio, SoundCloud, Spreaker, and anywhere you find your favorite podcast. Thanks, everyone. Have a great rest of your day.